Hello, this is Michelle from PhysioActive Indonesia, bringing to you episode 12 of Singapore Surgeon Insight series. Today, joining us is Dr. Tan Ken Jin, orthopedic surgeon from OrthoSports Clinic, Singapore. How are you, doctor?
I'm very good. Thank you for having me on board today, Michelle.
Doctor, can you tell us about your qualifications?
Sure. I'm Tan Ken Jin. I'm an orthopedic surgeon. I practice at the OrthoSports Clinic at Mount Elizabeth Novena in Singapore. Our clinic is a multi-specialty clinic. We have 5 doctors. For my practice, I mainly do surgeries around the foot and ankle. That's my particular interest. And in that region of the body, I mainly do two big kind of issues. One is basically like sports injuries of the ankle, and the other one, which we are talking about today, is bunion surgery. So I have a passion for minimally invasive bunion surgery.
So, as doctor mentioned, today we will be discussing bunions, also known as Hallux valgus, which is a common foot condition in adults aged 18 to 65. And it is also more common in women than men. Am I correct about that, doctor?
Definitely, certainly. We see most of our patients are actually ladies.
Okay, well, then let's start with you perhaps telling us what it is, its symptoms, and causes.
Well, the word bunion actually is not like a very unknown term to many people. In a regular layman conversation, if you use the word bunion, I think maybe at least half of people may understand what you're talking about. But medically, perhaps what a bunion is not just a bone that's sticking out of your big toe, but if I could use, let's say, a foot model. So if this is the big toe, what a bunion is actually it's a deformity of the joint of the big toe, where the big toe actually bends towards the second toe. And this bone here, which is the metatarsal bone, it then bends out. And so a bunion, which is that bone you see sticking out of your foot, is actually a deformity where the joint is actually out of position. And that's actually what a bunion is in terms of its anatomy.
And what causes this, doctor?
Well, there's no one specific cause. Bunions, we currently feel are multifactorial. That means there could be many different causes. In many people, they are probably, or they rather probably have a genetic kind of basis. That means many people or many ladies, they are born with a predisposition to have bunions. So if you ask, let's say, a lady with a bunion, anyone else in the family has, many of them actually they run in family. So there's definitely a genetic predisposition. It tends to affect ladies more. In certain people, the footwear that they wear, particularly if you are wearing a very tight footwear or like very high heels where the toes are squeezed into the front of the shoe, and you do that for a long time, that can contribute to formation of bunions. In others, it could be their biomechanics. That means certain people walk with a certain way that puts a torque on the big toe, and particularly if you are flat-footed, it tends to push the big toe out towards the second toe. So certain biomechanical kind of causes are also possible. The last one, which is slightly less common, but we do see sometimes, is a trauma. That means sometimes it's, the foot's normal, the big toe is normal, but an injury to the big toe where the ligament on the one side of the toe gives way can then result in an imbalance in the joint, and then a bunion can then form.
Okay, so let's talk about the treatment. Can we stop a bunion from growing? Can it go away? Otherwise, can we straighten it without surgery? And what are your thoughts on bunion correctors and protectors that are readily available for purchase?
Most of the time, people who have bunions, some of them may not always have much symptoms. So they may not need much treatment. But when symptoms start to occur, I mean, this could be pain, swelling in the big toe, or inability to wear certain types of footwear, In our part of the world, in Southeast Asia, we see more and more travel. So people travel overseas to cold countries, and then when they wear like boots or closed shoes, then that can result in the bunions getting more painful. But basically, people want to treat their bunions when they start giving them some symptoms. The simplest way actually which you can use is to make sure that you have a comfortable kind of footwear. So usually we will advise people to avoid high heels, something flat or a low heel with a wide toe box will probably be the simplest way to treat. You can also, of course, take some anti-inflammatory medications if the bunion flares up a lot. If you go online, of course, like you mentioned, you see a lot of things being sold that you can buy to put on your foot to try and straighten the toe. Generally, we don't feel that these really work very well. They can give you some temporary relief, but they don't give a proper correction to the toe, because once the joint is bent out of position, there's an imbalance in the tendons as well as the ligaments, and that can't truly be corrected by just putting a splint. Finally, sometimes we will actually fit some insoles for patients who are flat-footed with bunions. Sometimes raising up the arch with an insole can help reduce the forces on the bunion, and also can be a simple way to treat bunions. Of course, the final way to actually, in a way, correct a bunion would be surgical.
So let's talk about the surgery in more detail, doctor. What are the indications of surgery and what does the surgery entail? Perhaps you can give us a brief explanation of the procedure involved and a travel itinerary for Indonesians planning to come to Singapore for this.
Sure. So the most common reason we do bunion surgery would be, like I mentioned, for symptoms. That means if the bunions hurt, simple treatment like wearing a comfortable shoe or taking medication on and off hasn't really helped much. And the symptoms may be progressing, or the deformity, that means the bone that's sticking out and the way the toe is aligned may be getting worse for someone. So that's the most common reason to do bunion surgery. Some patients who have milder symptoms also do bunion surgery because they are trying to treat it early to prevent progression. That can also be an indication in some patients. And a common kind of story you hear may be a lady and she has bunions and her mom has bunions. And so she's seen what her mom's feet are like 30 years down the road. So she's seeing what her feet are like and she's thinking, oh, I don't want to be there in 20, 30 years time. And even though I have some symptoms, maybe not too bad, but they're actually keen to do something early. So that can be another reason why we do surgery for bunions. Most of the time, bunion surgery, for most people, it will involve both feet, because most of our patients actually have bunions in both feet. Rarely we have only on one side, but most of our patients are actually both feet. The surgery for bunions, there's many different types of techniques for surgery for bunions. A lot of the surgeries are, at least in my opinion, slightly invasive and require open surgery. My preference is to avoid that kind of surgery, and so I specialize in minimally invasive type of surgery. There's a couple of differences. I mean, one main thing is that for open surgery, typically an open incision, let's say we use the model again, an open incision is made, and then a surgical saw like this is used to make saw cuts in the bone to correct the bunion. So the main difference between that and minimally invasive surgery, number one, is that we have smaller or tinier wounds to do the surgery, and we cannot use a saw, so we use a little pen-like device like this, and that makes a much finer cut in the bone to do the correction. Over time, as you are more familiar with this technique, it makes the surgery not only less invasive but actually faster, because the wounds are small and we don't spend time doing other things like needing to close the wounds, for example. The surgery is typically X-ray guided when we do a minimally invasive bunion correction. And typically, after we've made those fine cuts, the bone is shifted to realign, and some small titanium pins are used to hold the bone. So if you see like this is a model, and the bone's made transparent so that you can see the titanium pins that are put inside. Those give a very stable correction, reliable correction, and allow patients to weight bear. That means to walk on their feet immediately after surgery. Most of the time, a type of post-operative sandal, and I have a demo one here. A sandal like this is used to walk immediately after the surgery. So, what is the experience like from a patient's perspective? So for our Indonesian patients, usually how we tell them is that coming to Singapore for bunion surgery typically starts with a consultation first. This consultation nowadays for many Indonesian patients, we do it by teleconsultation. That means we set up an appointment, we do like what we're doing now. We do a Zoom call and we speak to them, because most of the time the diagnosis is not in question. Bunions are easy to diagnose, and it's more about discussion about what the treatment will involve. Yeah, so usually you start with a teleconsultation. If everything is good and patient is comfortable, then we will decide the time, or they decide the time they want to do the bunion surgery in Singapore. And usually how we plan it is that it's a 2-visit treatment. So the patient will typically fly into Singapore on the day of the surgery or the day before. Then we will meet in person, face to face, answer any other questions they may have. Then on the day of the surgery, typically you come in for the surgery. The most common is we do a general anesthetic. That means there's a small injection and then you go to sleep. Each foot takes about 40 minutes. So in total, it's slightly over an hour for 2 feet. After the surgery is done, you wake up and then basically you go to the ward and rest. And then a physiotherapist comes and trains you to walk with the sandals I just showed. Most of the time, we will say the first visit to Singapore is 3 days. So you can, a popular choice is like to fly in on a Friday, fly in the morning typically from Indonesia. And then we may do the surgery on, let's say, Friday afternoon. We'll meet first, do the surgery Friday afternoon or Saturday morning. And a lot of the patients will fly back on Sunday or Monday later. So it's like a weekend thing. When they fly back, basically we arrange it in a way that the dressings are done in a particular way that they don't have to be changed at all back in Indonesia. They will just be walking with the sandals, which we provide 2 pairs. One is for indoor and one is for outdoor. And then typically the second visit is about 3 weeks later. When you would fly back to Singapore, we would open the dressings, remove some stitches from the keyholes, do an x-ray to check, and then after that you may fly back. The sandal is typically used for a total of 4 weeks. After that, the sandal is removed, and then you may use a cushioned, comfortable sandal or white shoe in the second month. And the next checkup, usually if the patient's free, they may come back to Singapore a month later. If not so free, we do back to teleconsultation.
Okay, and what kind of activities do they need to avoid in this 4 weeks or even longer than that?
So for the first 4 weeks, typically you'll be walking around with those sandals. There's not a lot of exercise you can do. Some of our patients will go to work with a sandal. Others will rest at home or work from home. Some essential activities, some patients will use the shoes to, let's say, walk their dog. Others can wear them to do some upper body or core exercises in the gym, but not much for the lower limbs. That's just for the first 4 weeks. In the second 4 weeks, after the first check, usually you can come off the sandals, and we would be doing mainly non-impact activity. So that can include like using a bicycle, getting into the swimming pool, going for walks, yoga, Pilates. Sometimes we do physiotherapy in the second month for toe mobilization, for gait training, and for swelling management as well. Typically, impact activity, that means the runners, to return back to running or playing tennis, we typically tell patients to wait till the 4th month. That's basically because we want enough bone union to occur before we do impact activity.
Is there any other information you'd like to add for our viewers, Doctor?
Well, maybe one thing I like to say is like, I always say bunions, they are like a deformity. So it's almost like having a wisdom tooth that's not in a good position. Yeah. So typically for any kind of deformity, it's always good to treat it slightly earlier. The main patient group that we have a slightly increased risk of bunion surgery are basically the older ladies, that's because they have actually waited a long time to treat their bunion. And so typically, let's say a 70-year-old lady who comes in to do bunion surgery, we can still do it, it's not a problem. It's just that typically at that age, the deformity, the bunion is actually quite severe. So it's actually harder to correct, number one. Number two is typically for ladies after menopause, they lose some bone density. So let's say, from 50s to 70s, the bone density actually drops. And because bunion surgery is a bone surgery, so there's a slightly increased risk of issues with the bone. So we do encourage people, if possible, if they have some issues with their bunions, to treat them when they're about medium stages. That's always the best.
Well, this is great information, Doctor. Thank you so much for your time and all this information. For our viewers, if you're interested in speaking with Dr. Tan, you can find details of his WhatsApp, clinic phone number, and website in the description below. If you're planning to get your surgery in Singapore and live in Jakarta, you can start your physiotherapy at PhysioActive Singapore and continue your rehabilitation program in PhysioActive Indonesia. Please find details of our clinic below. On behalf of our entire team of PhysioActive Indonesia, we want to thank you for tuning in, and we look forward to bringing you more top quality content from leading industry surgeons. Thank you.
Thank you.